Hello again, everybody. Sean here with the final update on my two-level cervical spine artificial disc replacement at C5 to C6 and then C6 to C7. Um, I had the procedure 3 weeks ago, so tomorrow will be the 3 week mark on Monday, July 7th. And I kind of wanted to come back and recap on everything that happened, the procedure itself, pain management, the incision, the bandages, the normal daily life stuff. And once again, this is in hopes that my experience can provide some information for anyone that is considering this procedure and kind of help you guide that decision process. Because there's a lot of folks on the internet that have either reviewed it or had, I would say it's mostly positive experience. And just right out of the gate, I will say that mine has been an extremely positive experience. But I want to give further detail on all that stuff. So, um, the recap on the surgery. So, like I said, it was the 16th of June, 2025. I went in the morning. It was 10 a.m. Mountain. I showed up at the facility. It's here in one of the small Denver metro areas, Englewood. I had my procedure done at a place called Colorado Brain and Spine Institute. And the same facility has the surgery center a few floors above the Colorado Brain and Spine Institute. So I had my consultation was at Colorado Brain and Spine, and then the surgery was in the same facility with the same doctor, the surgeon, just a few floors above, and that's called Synergy Surgery Center. The staff, everybody that did the consultation, everybody that did all the like imaging review and all that sort of stuff, everyone was very polite, very friendly and helpful. I knew I've said this in my previous video, but I knew what I was getting myself into, and I felt at ease that these guys had done this before, and I can confidently say that that is accurate, and they did a great job. So procedure was from about noon to 2 p.m., 2:30 p.m. that day. I was in the car heading home around 4:30 p.m. Mountain that day. Um, and I was, still under anesthesia or coming out of it rather in the recovery area and then getting home. But you'll see, I had a couple hours after I got home. I was able to record my, 2 hours post op, 5 hours post op, whatever the number was, video, and it's here on YouTube on my channel. So if you're curious, go check out the other videos. But the discs that they installed, I was able to confirm that those were Medtronic Prestige LP discs, and I've got the follow-up appointment X-ray images, and I'll show those on screen here shortly. And I want to talk about pain management. We'll look at the actual discs themselves and the X-ray image. Talk about the incision and the bandages. How my arm is doing. How the actual did we actually fix the issue? And then I'll be starting physical therapy again soon. And then basically just a recap on recommendation as to what I would do if I was given this, just if I was presented with this decision again. So first thing, pain management and the muscle relaxers. So for the first, you've seen this in my other videos, but the first week was pretty rough for pain management. And when I say rough, I'd say like 6 or 7 out of 10. And to be even more specific, it had nothing to do with the incision. It had nothing to do with the surgery site where the actual procedure took place. It was basically my muscles in my body, specifically shoulders and muscles going down the back along each side of my spine, just incredibly sore. It felt pretty much like I had been hit by a truck. But that went away after the first week or so, and I was able to get through that pretty comfortably, beyond the 1 week mark, basically. As far as the incision was concerned, that really never exceeded like a 3 out of 10 on pain the entire time. I will say the bandages that I recommended, which I actually have them here, I'll grab it. The bandages that I was recommended, well, it was a YouTube video that I watched, and I referenced that the gentleman's channel in one of my other videos, but these are very, very good. I highly recommend them. They claim to be waterproof. They are waterproof. They work very well, so I would highly recommend those. One of the downsides of them working so well is that the adhesive on them is incredibly strong, and my skin after the first week, because I was changing the bandages, adhesive coming on, going off, my skin was incredibly irritated after that. So the good news is after the 1 week mark, I actually didn't really have to use the bandages anymore, and my skin was able to kind of heal from that, and I was put some moisturizer on it and things. Um, but the incision itself is healing nicely. Take a look at that here on the camera. It's going to scar over really nicely, and with the right collar on a shirt, it'll kind of tuck underneath there, which is nice. This one's a little bit more loose fitting, so you can kind of see it if it ruffles out of the way or whatever. But overall, it's really not that bad, and there's not much pain associated with it. It's just if I press on it, it's a little sore. It doesn't really bother me at all. But that's kind of the incision and the bandage is part of it. I would say I highly recommend the bandages. Just take care of your skin and keep it nice and clean as you're going through that. They're perfectly fine to use in the shower. You can do your normal shower routine. I was able to shower the first day after getting home, so I did my normal shower routine the day of going before the procedure. Next day, I slept. My sleep schedule was very sporadic, but I was able to get up and shower the next day after the procedure, without any complications or anything like that. And as far as the arm is concerned, so my primary issue where this journey began, and you'll kind of see some of this in my other video, but where this journey began was if I went to the back or if I went to the left, I would get some fairly severe arm pain and then loss of sensation in fingers and back of my arm. That's obviously not very good for quality of life. So that's where the consultation began, and that's where the journey began. Um, and so it started with an MRI, and then we were able to review the issue with C5 and C6 and C6 and C7. And I have those images that I shared on another video. And we'll take a look at the actual the new discs here in a sec. But as far as the arm pain and the sensation and the tingling and the symptoms that I was experiencing, that is all completely resolved. 100%. My muscles are still a little bit sore, like in those areas, and that's localized, like muscle strain. That's just not something. My body is not used to moving in those like those directions or that in that way. So that's the biggest change, is that I'm now I knew this was coming, but I am now having to behaviorally unlearn those basically those muscle movements where I avoid going to the left, because now back into the left, it's completely fine. My arm feels totally normal. It's the same on both sides now, whereas my right hand, which is left here in the video, my right hand was completely fine before the procedure, and my left was, if I went far enough and held it there long enough, it would be pretty extreme pain and loss of sensation in the arm. So no permanent damage. That's good. I have all of my feeling and sensation in every finger and down the back of my arm. It's all there. Feels entirely normal. So I am very thankful for that. And also the recovery. The recovery was honestly really, really mild. It was really mild. So to wrap all this stuff together. Oh, yes. I almost forgot. We need to take a look at the image. There we go. All right. So can I zoom in on this? I don't know. Anyway. Okay, so this is the this is the front facing view. You can see the two discs at C5 to C6 and C6 to C7. They are the Medtronic Prestige LP discs, which they have these little, I don't know if you can see this, my mouse here, but they have these little kind of front facing, this is towards the front of the neck. These little, I guess, eyelets, I guess is what we'd call those. And then you can obviously see the channels where there's a cut into the bone, and that is what guides it in and keeps it in place. And then on the Medtronic Prestige LP, as well as the other ones like the Pro Disc, there's kind of a rough surface on the top of that where it actually meets with the bone, which would be right here and down here on the bottom. That promotes bone healing and bone growth back to the plate, so that way they kind of adhere better, and it's more of a permanent, you can live normal life without risking it moving around basically after it has fully healed. They do look physically a little bit different. So the bottom one here is the C6 and C7 one. They do look a little bit physically different. That's fine. I'm not sure. I don't know anything about these things. But here's the second, or the side view rather. So in this one here, you can kind of see they are just a little bit different shaped as far as how they come together. So that's kind of interesting. Like I said before, I don't know a ton about it. I don't know how the decision process gets made as to which ones go where, and size, and obviously it's tailored to each person. But It is pretty mind blowing that these tiny little, oh, I guess I'll move that over, that these tiny little implants, and they look huge when you look at them on an image like this, but these tiny little implants have drastically improved my quality of life. Which brings me to the last bit of the video here. Um, I had said this in one of my other videos, but overall, my experience, now keep in mind, I had specific to me symptoms, and these cervical spine things are always going to be unique to each person. You could categorize things as general, symptoms or whatever the case is for everybody, like, loss of sensation. But the actual, the exact cause is going to be unique to every person. For me, it ended up being a combination of disc degeneration at those locations, as well as bone spurs, or what they, I guess, is also called osteophytes. So, in addition to, it's not really terribly visible here in the X-ray, but in addition to replacing the discs, there was also removal of the osteophytes or bone spurs too, which feel like that would be a pretty big deal for nerve-related symptoms too. So forever grateful for that. So that's the first thing, is that everyone's scenario is going to be unique. Everyone's symptoms are going to be, tailored to them, so to speak. But for me personally, given what I've shared with you about the symptoms and the issue that I had, the procedure, these new discs, and the staff, and everything that happened, I am incredibly thankful. The only thing that I would say uh, is that I am upset with myself for not having done it sooner. That's the only thing. That's my biggest regret, is not doing it sooner. Something like this is terrifying. When you do research like this, you're like, man, I'm getting parts of my spine replaced. They gotta do an incision, and it's gonna be gnarly, and I'm scared and all that sort of stuff. But after everything that I've been through, as far as this procedure is concerned, that's the only thing. That's the only thing that I would take away from this, is that I should have done it sooner. The recovery process, I'm at 3 weeks. I feel pretty close to normal. I still have some soreness. I have a weightlifting restriction. I can't lift heavy objects still. I don't have to wear the cervical collar anymore, which is lovely. But realistically, life is pretty normal at the moment. The only thing that I still have restriction on is weightlifting or heavy objects. So um, I have normal showers, all that sort of stuff. Everything is totally fine, and I don't have the bandage anymore. That stopped after the first week. So I guess my recommendation, if people are considering this, is one, get as many opinions as you feel necessary for you. If that means a second opinion from another specialist, that's great. I totally support that. It is a pretty it is a pretty serious operation. It is minimally invasive. It's not a huge deal to have the procedure done, but you definitely want someone who knows what they're doing. Um, I I can't imagine there are too many people that practice this and perform these spinal surgeries that don't know what they're doing. But there are negative stories on the internet of people having a bad experience with it. So do your research. I would highly advocate that. The other thing is too, um, I guess I got lucky because at Colorado Brain and Spine Institute, the reviews for most of these procedures was overwhelmingly positive. And so from when I was briefed on what was about to happen to me, as well as knowing the doctor's history, those two things in combination gave me a level of confidence where I personally did not seek out a second opinion. Um, with how overwhelmingly positive the reviews were, I felt pretty good about going into my situation. Now, some of that could be luck, but the reputation stands out for itself. So these guys know what they're doing. So that would be basically that would be my other primary recommendation, is that just make sure that you take your time and do your research, because it is a pretty serious procedure. And if there are complications, that can be a bad time. So I actually see this on the second image here. You can kind of see the little grooves on the Medtronic Prestige LP disc insert here at the top and bottom, which is kind of funny. Looks like a little sawtooth thing. But anyway, that's the recap on everything. 3 weeks, I feel great. It's just the weight restriction. I'm able to do normal things at home. I'm able to take care of myself. The incision is obviously healing up. Let me do the full screen thing again here, and we'll look at the incision again. but it's healing up. It doesn't look too bad. It's actually kind of tough to see, especially if you're unless you're looking for it, basically. So I feel really good about the whole thing. I'm happy that I did it, and I hope that this video and all the information that I've provided in this video and my other videos, that helps gain either a level of confidence or helps you with your decision, whatever the case is. But thanks for watching. Thanks for stopping by. Appreciate the views, and good luck with whatever you're embarking on your journey.